who won a speech competition there is evacuation or speechless now. But I don't think so. It is true because in one way or another, we can enculpt or integrate our extracurricular activities that we excellence to bring our sector into an uplifted way. So, with that said, Mr. Balamurugan holds the prestigious distinctions of having participated in the world's longest multinational conference, an event that spanned over 2,600 hours in honor of Dr. APJ Abdul Kalam's 19th birth anniversary. His voice has echoed across various platforms, and we are really happy to have his voice in our RX Doctors platform too, earning him an accolades of international, national, state, and district levels, including multiple first place victories in Tamil elocution competitions from Raja Mutaya Medical College to PSG College of Pharmacy. Among his many achievements, he has selected as one of the top 20 debaters across India in a national competition hosted by Times Now and Federal Bank, and has earned recognition from institutes like Vijay TV, Shankara TV, and even from esteemed leaders such as Dr. K.L. Murugan and Dr. Sudha. He currently serves as a joint director of Din Tamil Sangam and has organized over 20 impactful conferences promoting Tamil language and culture. His leadership extends to his role as a former student, council president, and as a medical scribe for US healthcare providers. He was also honored as the voice of PSG for the year 2022. If you some people know, PSG is a very reputed institution and topped his seventh semester with a remarkable SGPA of 9.25. With a powerful voice, a sharp intellect, and an unshakable passion for service in language, Mr. Balamurugan is a rising star and an inspiration for today's youth. So he's going to be sharing us about how to kickstart your career as a medical scribe. So please join me in welcoming Mr. Balamurugan.
Am I audible?
Yes, sir.
Yeah, thank you so much for your wonderful introduction. Good evening, everyone. Let me share the screen. Can you see the screen?
Yes, sir, we can.
Yeah, thank you so much. All right. Good evening, everyone. I'm truly honored and excited to be here today at SECON 6, the 6th International Conference of RX Doctors. A big congratulations and best wishes to the entire organizing team for putting together this meaningful and impactful conference. Honestly, it's inspiring to see so many brilliant minds from across the globe gather here with a shared vision of advancing healthcare and creating better career pathways. Allow me to introduce myself. I am Bala Murugan, currently working as an ACE medical documentation specialist at Boji Healthcare for the past 2 years. Today, I'll be speaking on a topic that's not just close to my heart, but also holds great promise for the future of healthcare careers. Kickstart your career as a medical scribe. Whether you're a fresh graduate or a pharmacy student, or BPT or nursing or any other allied health sciences or healthcare enthusiasts, BDS, MBBS, anyone who are enthusiasts looking to step into the US healthcare domain. This session is designed to guide, inspire, and prepare you for one of the most in-demand and fast-growing career roles in the industry. Let's explore how medical scribing can be your gateway into the clinical world, boost your skills, and set the foundation for a global healthcare career. Please note all your questions at the end of the session. Please ask me. I'll answer each and every question. All right. Understanding medical scribing. Let's begin with the basics. Imagine a doctor seeing 30 patients a day and spending more time updating charts than speaking to patients. This is where a medical scribe steps in. A scribe is the physician's assistant, not in a medical sense, but in a documentation. Yeah, in the medical sense too, because we are all pharmacists and healthcare graduates. We listen, observe, analyze, critical think, and record and finalize the conclusion. In the past, everything was paper based. Still, so many hospitals are following paper based. Some of the hospital in India, they are having their own softwares website to upload patient healthcare details, their entire past histories, medications details, and all. In US, they are following. We all know electronic health record. They'll be recording each and every details about the patient day to day. They'll be uploading there. So this system now has gone digital. Scribes are essential to ensure accurate and real-time clinical documentation. So that's why we help reduce physician burnout to improve the quality of care. Scribing is not just supporting role, it's a core part of model clinical practice. All right. Who is medical scribe? So what exactly is medical scribe? We are professionals who document real-time interactions between doctors and patients. Knowing like what is medical scribing? Every symptom, every examination, every diagnosis, every treatment and plan, what medications they are taking, what specialists they are seeing currently, each and every detail about the every individual patient will be documenting in real time. This is not like day basis task or week basis task. You, when you're connecting with the provider, we'll call doctor as provider in US healthcare. When you're connecting with the provider, if they are seeing a patient in 30 minutes, in that 30 minutes you will be analyzing everything, you will be observing, you will be listening to each and every word what they are talking, and you will be documenting every single thing. You should be doing multiple clinical tasks there. You should see what they are telling, what currently what symptoms they've been experiencing, what medication they took last week, currently they are seeing home, what medication they'll be needing. Everything you will be typing and sitting and observing and typing in the real time. So we work in different environments like hospitals, outpatient centers, private clinics, and increasingly telehealth. So we act as the doctor's digital partner, so helping them to focus on care while we ensure every word is captured accurately in the AHR. So this works, I'm telling you, demands a high level of focus, confidentiality, and communication skill. If they are working 10 hours per day, if one provider is seeing 30 patients 10 hours per day, you will be sitting and you will be observing each and every minutes what they are talking. It's, you should pay more and more attention towards patient and provider. You might be thinking, why after bachelor's, why I can choose to medical scribing when other so many options are there? Yeah, so many options are there, but you have to decide your career pathway. Okay, according to me, I want to pursue MBA in global healthcare. So that for that sake, I should be doing something to know about how the world healthcare works. So I chose US healthcare. You know how prestigious we can say US healthcare, how modern. We are also improving day by day, but in the documentation wise, US healthcare is better nowadays. So I try to give a shot. Okay, let's be a scribe and learn how they are working. That's how I started after my graduation. I just got placed in Voji Healthcare. I went through 6 months of training and then I started my lifetime scribing with one provider. So this will be hard at initially because you will be connecting to the doctors from US. You should be talking with them day to day basis. You should understand how they are talking, their way of communication, how in advanced vocabulary they are using, and some of them might be having accent. You should pay attention to each and everything. You will be learning day to day, and you will be upskilling yourself day to day by doing something more than your day to day task. So that's how you have to elevate yourself every day. Let's see key roles and responsibilities. I can say a good scribe allows the physician to focus on the patient, not the paperwork. We document patient histories, as I mentioned earlier, capturing why the patient came in, what symptoms they describe, how long they've had it, what medication they took, what support, what will be the need currently for them, what our provider can do for them. So that's how you should understand, you should critical think, you should conclude yourself. You will be simulating doctor because you are doing doctor's work in the name of doctor. So you will be doing their work and they'll finalize your document. So we document physical exams. Imagine a patient is coming for a knee pain. So obviously doctor will examine what exactly happened. Any injuries are there, any infection are there, anything inside bond something and all. So they'll be analyzing, they'll be checking everything. So at the same time you will be connected to them and you'll be listening everything what they are doing and you will document every single thing. Scribing is not just sitting and typing and writing kind of essay. You will be doing so much multitasking other than scribing. Example, see, you will be ordering the labs. You will be ordering the radiology findings. If that patient wants X-ray or scan or MRI, you will be ordering, and you will conclude the diagnosis. See, if patient is coming with symptoms of sneezing, cough, and all, either you should focus their past medical history, whether they're having asthma, COPD, or just currently they are having seasonal allergies, or like they are going through some upper respiratory infections. So like such kind of decision making skill you should be having at the spot, because you won't be having that much time to conclude anything in the 30 minutes. If they are seeing one patient 30 minutes, in that 30 minutes you have to conclude everything on yourself. So that much responsibility we'll be having. And we update EHR in real time. We also help access patient records, pull up previous notes, and even manage orders and referrals. Imagine you are stepping into other one of other countries healthcare system. You will be having their access, healthcare access. You will be having their EHR. You will be having all their patient documented details. Then imagine how much responsibility you should be having, how much confidentiality you should be having. You shouldn't talk about patients funny conversation with other people. You shouldn't mock people's conversation the way they are talking. Yeah, we know some of them, they are native speakers, their way of communication will be different. So whatever, however the visit is going on, you should focus 100 percentage professionalism. So above all, we must follow HIPAA guidelines. Patient data is confidential. It must be treated with the highest level of professionalism. You are not allowed to share the data with anybody. See, every scribing company, they'll be following this HIPAA guidelines very strictly. So people who are all working from office, they are not allowed to carry their mobile phones to their desk. So every office will be having biometric entry. So after you are leaving all your electronic gadgets outside in your locker, then you will be allowed to enter into to your place. There you will be working, because we will be talking to the provider about patient's healthcare, patient kind of details, everything. So it might be a chance to leak their data. So that's why it's very strict. We should follow very strictly this HIPAA guidelines wherever, whichever the organization we are working in. Okay, what essential skills for a scribe, medical scribe? To be a good scribe, you need four major skills: listening and typing, medical terminology, grammar and language, multitasking, and focus. Listening and typing. See, 30 minutes, they'll be talking very fast. Some of the providers might be having accent. Some will talk slow. Some patients, you cannot expect all the patients' voice will be clear. Some will be the like 18 years old. Some might be 70 years old. You should be listening carefully what they are talking. At the same time, you should be typing each and every detail. You should be writing like an essay. Then imagine how much your typing speed should be. I always say a minimum 65 to 70 typing speed for a good decent medical scribe will be needed. So listening and typing, the comprehension, everything is very much crucial when it comes to medical scribing in real time. So the next one, medical knowledge. So we all know, we are all from healthcare background. Understanding medical terms is very much essential. Example, you should be knowing the difference when patient is talking about, like if you're connecting with a cardiology doctor, you should be knowing the difference between myocardial infarction and then angina. So that part is very critical and crucial. Another one, grammar and language. I'm telling you, your notes must be very much professional and clear and error free. You are documenting legal medical records because no other people will be having access other than you and your doctor. Your doctor will be having the access to all the patient's medical health records, and apart from that, you will be having. That's why I'm repeating again and again how much confidentiality should be needed in this medical scribing field. And the another one, multitasking and focus. As I mentioned earlier, you are not just sitting and typing, writing an essay. You will be doing a lot and lot of other tasks also. You will be writing in HPI. I hope everyone aware of HPI and also OpNote and all. You will be writing HPI at the same time. You will be concluding, okay, this patient is talking about this particular symptom. This might be related to their past history, either hypertension or some other cardiovascular related problems. So you will be deciding that time, you will be concluding, and then you will be focusing on that also simultaneously. Okay, patient is they are talking about thing, provider is telling, okay, let's move forward with some MRI or some X-ray. So what you have to do, you have to immediately stop your documenting. Immediately you should go to that imaging part where you can be ordering that imaging details and all. You should be ordering X-ray. So like that, you will be doing multitask at the same time within 30 minutes of visit. Next one, types of medical scribes and work environment. There are two types. One is on-site, another one is a remote virtual scribe. We all know on-site scribes in US healthcare. So many healthcare professionals, they'll be doing on-site healthcare in the US. But we will be sitting and connected to the doctors from our home or from our office from here. So they will be physically present with the doctor, either in hospitals or clinics. They move between patient rooms and interact with the care. We remote scribes, the most popular model today, we connect with doctors via secure online platforms. Like, see, I am connecting with my provider through the Teams only day to day from our homes or official offices in India. We document US patients visit in real time. So the most, when it comes to US healthcare, you are working as in real time. So definitely it will be a night shift. I'm telling you. So every the difference between US and India is 12.5 hours difference right now. So if they are starting morning 8 a.m. with the patient, first patient, so here it will be 8:30 p.m. So that's how we will be working in night shifts. Yes, it's night shift. It will be like 8 to 10 hours minimum per day. And also there in US, people, doctors will not be working all the 5 days. They'll be working only 3 days, some of the provider maximum, and some of them will be working 4 days per week. So one day you can chill, and one day you can upskill something that you can prepare yourself for the next week. So it'll be flexible when you're totally into medical scribing. So the benefit is no relocation. We don't need to go to US. We will be sitting in our home and we'll be assisting them. Also global exposure and immense learning. The next one, career growth and opportunities. Medical scribing is not just a job, it's a stepping stone for everything, I can tell you. It's perfect for graduates in pharmacy, nursing, life science, MBBS, BDS who wants US clinical exposure, who are all wanted to learn how US healthcare works day to day life. What are all the advancement they are implementing day to day life, that you can learn everything. Many scribes transition into, yeah, because they are so many scribes will be transitioning from scribing after gaining your so much knowledge and experience. You can switch to other roles. See, as I mentioned earlier, I wanted to pursue MBA in global healthcare forum. In the sense, I'll be learning all this stuff almost 2 3 years. I'll be rich in that knowledge, and then I'll move to the other management roles. For that, if you're going out of India, if you say you worked with US healthcare doctors in the real time, and they'll be considering, all right, okay, then you're a good candidate to do some kind of in the healthcare forum, because you already will be knowing India's healthcare system, how it works. At the same time, you will be knowing another country's healthcare system, which is most reputed one, the advancement thing. So wherever you are going, this will be helpful for you in the personal and also professional ways. So many scribes nowadays transitioning into medical coding and clinical research and medical transcription, quality analysis, and hospital administration. The scope is vast. You can go anywhere after medical scribing, after you gaining a lot of knowledge. It's also great platform for planning higher education abroad. Because why I'm telling you is because you're already understand electronic health record, you're already will be knowing US documentation, how their physician workflows. So it'll be very helpful to you to start your up next level. Also, you can be a great scribe here, next moving levels, and you can go to team lead, and you can be a manager. You can manage your organization, like you can the client meetings and everything. The career growth is good in medical scribing. Next one, global demand and technological advancement. In the US, there is a huge demand for medical scribes due to physician shortage and burnout. See, we all know being a doctor in America is not a simple thing, because there are so many kind of designation will be allotted, like physician assistant and family nurse practitioner, and different providers like specialist cardiology, nephrology, neurology, like that. So for that, they'll be needing helpful to document. So for that sake, we'll be connected from India. So now currently outsourcing to India and the Philippines is growing fast. Also, technology is evolving. Speech to text like Dragon Medical. See, if you're talking in Word document, it will obviously turn into words. So many AI tools came nowadays. Suki, Deep Scribe, Augmetics are being introduced. AI is everywhere. But I can tell you, if AI takes full authority of my healthcare in their hand, obviously it is very, very, very dangerous, because you're blindly giving a patient's data in AI hand. So that's why I'm telling AI is not kind of how to say, we should not neglect AI, but we should grow with the AI. We should use AI, when we should upskill ourselves with AI. But here's the thing, I can tell you, AI cannot understand patient emotion. AI cannot conclude patients' need. But that's why I'm telling, AI can assist, but it can't be replaced. It cannot replace human judgment. Doctors still prefer a trained scribe who understand context, patient emotion. So that's why I'm telling you, you should you currently, I am not working with AI, I'm not using AI, but I'm working with real time with my provider. So this is their choice, whether they want AI, whether they can trust humans. So when it comes to that choice, it's always up to US doctors, not in our hand. Let's move to the next one, challenges and rewards of scribing. Yes, there are challenges. As I mentioned earlier, night shift. Yeah. So if you're more comfortable in night shift, you can opt definitely medical scribing. I told you, like, you can gain lot knowledge, and then you can switch to next roles related to scribing, related to your abroad studies, related to your management studies. Like that, it'll give you a strong portfolio. So mentally demanding, also must adapt to various doctors, accents, and speech patterns. I'll tell you, I joined in OG Healthcare 2023 May month, and after training, I started with my provider in real-time medical scribing in November 2023. Since then till now, I worked with 9 different providers, 9 different doctors. So some of them definitely will be having their accent. Some of them will talk slowly. Some of them will be like a very fast. Kind of communicable person, and different pain specialists, family nurse practitioner, physician assistant, and cardiology, nephrology like specialists. So that's why I'm telling you, if you're connecting with one provider, imagine you're connecting with one basic primary healthcare physician who can access day-to-day clinical data interpretation with the patient and who can see the patient like basic stuff. You will be knowing the basic. Trust me, I didn't meet a doctor for the past 2 years because I know they are telling so much. They'll give you suggestions. When they are giving suggestions to the patient, it's obviously for everyone. You can be known what are all the supplements you can take to improve yourself, what are all the medicines you can take to avoid certain conditions or cure certain conditions. So that learning is important when you are connecting with your US doctors, whichever the specialist they are. If you're connecting with a pain specialist, you will be learning and knowing a lot and lot of pain specialists about pain specialism. Also, if
So
you're
very
connecting to the
sorry to interrupt.
all right.
So very sorry to interrupt, sir. We couldn't see your slide. We could see the Teams page it is struck.
Oh, wait a minute. Can you see now?
So actually, what we could see is only the Teams page, not the slide.
Just a minute. How long it's been?
Like for around the 15 minutes or something, sir.
Oh, I'm sorry. You could have interrupted before only. Okay, I'll share again. Can you see now?
Oh yeah, sir. Yeah, sir. Now it's good.
All right. Thank you. Very well. Yeah. Like wherever you are, whichever the provider you will be connected, you should be learning from them and you should be upskilling yourself. Okay. Rewards. What will be the salary? Here is the main thing. So when you come to medical scribing field, I can tell you after a bachelor's, after graduation, if someone can pay you 40,000 above, if someone can pay you 35 to 40 as a basic starting pay, I can tell scribing is one of the platform because you are working for US healthcare. You are working in night shift, and you know that as I mentioned earlier, the responsibilities are more. You should be giving so much detailed attention towards the patient, towards the provider. You will be doing multitasking, so you deserve to get paid well. So that's why I'm telling all the organization where across the India medical scribing after training, because for the training period they'll be giving stipend around 25 to 20 to 30, that range. After 4 to 5 months of training, you will be coming to the real time production. There you will be getting around basic 38 to 40 as the starting pay. So every company will pay around starting pay, and in US on site, there people will be paying like 15 to $25 in the real time. There people are working from US with the skill based promotions. Also people who are all not not from healthcare background, so they can study on separate courses which is called CPMS. There you can get to know about the core, especially only medical scribing, what are all the things you might be needing when you're working with providers. So for that you should be paying so much amount, 3 lakhs 4 lakhs and all. Courses are there for 2 to 6 months and then 1 year courses. After that course you can join any one of the organization and you can start your career as a good scribe. But we people who are all from healthcare background, they don't need to do anything. You just join the organization, you just go through training, and then you will be starting your real time production. Okay, why we need to choose medical scribing? Why this career? Because you gain real clinical exposure without leaving India. So from sitting here, you will be learning US healthcare's day-to-day modern medicines, and you will be knowing their health records, how they are doing, accessing, and how they are ordering and labs and everything works. You will be knowing so much from sitting here. And then sharp clinical judgment and language skills. Clinical judgment, yeah. I told you earlier, when you're documenting, you will be having that rights to sometime to conclude, okay, this patient is related to this, so it might be the diagnosis. So you'll be doing basic coding. I don't know how many coding people have connected here. You will be knowing basic coding, ICD-10, which is called. So there, for hypertension, what code you can add, for angina pectoris, what code you can add, like that. You will be knowing all perspectives. And language skills, yeah, There are two types. I'm sorry if I didn't mention you. Two types. One is provider will be needing, like, I need to talk with the scribe day to day. I want to talk with them, and then I'll be working with them. So this is one type. And the another one, okay, I don't want to talk to the scribe because I can talk with the patients more time. I just will be needing, like, scribe's help, but they can text me if they want any help or queries. So such kind of providers will be responding to your messages, and you will be communicating with them through the messages. So other providers, they'll be talking. See, if I am working as a communicable scribe for the past 2 years, so she or he, they'll be, after every patient, will be discussing about the patient's any doubts if we have or something. We will be discussing and we'll be finalizing. Okay, this diagnosis will be appropriate. Let's give this plan. Let's prescribe this medication. Let's order this labs. Like that, we'll be communicating. So that's why I'm telling you, while communicating with US doctors, imagine how polite we should be, how much attention we should give to them. We should not show our superiority, because we should be humble enough while we are communicating, how we should communicate, at what time we should respond to them, at what kind of vocabulary we should be using with the provider. So these are all is very crucial when it comes to real time communicable scribing thing. Another one, you get global work experience. So as I mentioned earlier, it's very much ideal for people who are all wanted to pursue MS or MD or MPH, masters in physical health aspirants, because it's directly you are connected to the US doctors, directly you are seeing patients from US, so you will be knowing the vast knowledge about how their healthcare system works. So this scribing thing will be a key for if you want to pursue other next levels and all, that you will be getting such global work experience. And you build a strong base for any healthcare career. I'm telling you, you can switch to anywhere. If you're a scribe, you can, as I mentioned earlier, you can go to clinical research, you can go to medical coding, you can go to transcription analyzable, everything. Also, you can pursue your masters in MBA in global healthcare forum or hospital management, because you're working in hospitals, you are connecting with the provider, they are working in hospitals, so you will be knowing everything. You can be a physician assistant if you want in US, you can go and pursue. So options are more. It's about you, whether how you can choose. That's why I'm telling you, this medical scribing teaches you discipline, empathy, precision, and communication. All qualities of a great healthcare professional. For a good healthcare management or good healthcare person, everyone, they should be needing all this quality. So in the end, you are not just typing. Remember, everyone, we are not just typing. You are capturing stories that heal, and that's powerful. So, any questions? Yeah, you can ask me any question regarding this. I'll be happy to answering each one of you. And if you want to leave a message, you can leave here. I'll respond to that. Any questions? How to start? From where you should start? Anything, any type of question you can ask.
Hello, am I audible?
Yeah, yeah, yes, you are. Go ahead.
Yeah, hi, I'm Vedanta Chetri.
Hmm.
I've completed my MSc in clinical research. So my
Oh,
question
great.
is to you,
Okay.
like, if I pursue the field in medical scribe,
Okay.
what are the guideline to follow? Like, what is the roadmap? Because during my curriculum, I have
Hmm.
learned about all the guidelines, no, regulatory
Yeah, yeah,
documents
obviously.
and
Yes,
everything.
yes.
So this is quite different, I feel, because you mentioned about ICD-10, right?
Yeah,
So
because
yeah,
you
please
will be
elaborate.
knowing all. Yeah, see, if your clinical research background, it is you are overqualified, I can say. But you, if you want to move to other level, see, you do want to pursue your MS or MBA or here in India or in US or any other countries. Do you have any plans regarding that?
No, right now I'm not
Okay,
thinking
you
about.
want to start your career totally from medical scribing, right?
Yeah, if I want to start, then what is the roadmap?
All right. Okay. See, you are a strong candidate for medical scribing. If you are starting as medical scribing, you will be a baseline. First, you are a fresher, and then you will be knowing all the guidelines. You will be knowing all the guidelines already. So what you can do is you can just implement here. You can just follow the protocols, and you can just implement your knowledge here and go through with the US healthcare providers and learn and grow yourself within this forum. So you can be a first initially. There'll be a three different levels will be there in the any other scribing institutes like fresher, and then intermediate level executive medical scribe, and then one they are ace medical scribe who is super senior in the scribing field. After that, what you will be doing in the sense, after scribing you will be the ambassador for medical scribes who you will be onboarding the providers. Like you will be a bridge between another like a fresher medical scribe and another provider. You will be train that medical scribe, and then you onboard that provider after he's getting or she's getting doctor approval. So you will be a trainer level, and that base we called onboarding ambassador. Different organization will call it like trainers or some other roles. And after that you will be moving to deputy client manager, so managing level. So when you're moving now, you will be assisting your manager. You will be that time you will be knowing and assisting and speaking with the clients which are doctors from US. You will be speaking to them, and then you'll be ready onboarding them with your organization scribes. After your DCM, deputy client manager, you're obviously a client manager. So you will be in management level. You will be bringing so much providers, doctors to your organization. And this is the growth from a fresher scribe to senior super scribe. From senior super scribe to you will be teaching the scribe to how to work, and you will make them doctor approved scribe. And then you will move to management level, deputy client manager, and from the deputy client manager to manager. After that manager, if you are very much skilled enough, within few 5 to 10 years you will be reaching the most prestigious position of operation manager of one of the organization. Career cycle is like this. If you are really like this kind of career cycle, you can obviously choose medical scribing field, because I'm telling you it's quite fancy. At the same time you can learn a lot of things, learn totally lot of things from across the globe providers. That's what I'm telling you. So this is the career path. Hope I'm clear. Do you have any doubts regarding that?
No, I completely agree with that.
All right.
So
Thank you.
one more
Mhm.
thing, you have
Okay.
mentioned about CPMS, right? The
Oh, yes.
certification, one
Yeah.
course or something, it's around 3 to 4 lakhs
Yeah. Yeah.
it
It starts
required to achieve
differs.
it.
Yeah. 2 to 5 lakh, maximum 3 5 lakhs I've heard. Yeah.
Mhm.
In that. Oh,
So, like,
you
is
okay.
there any certification needed for enrolling in this? Because
No.
still now I have not get chance to do like in ICD 10. I haven't go through.
Okay.
So if I start a career in a medical scribe, so
Okay.
what are the question they may ask about it? Like because my expertise are different,
Yeah. That's why.
right?
See. Yeah. That's why I mention any healthcare graduates. It's very simple. If you're very much good enough in English, typing, listening, and speaking skills, first one, and the next one, you should be knowing all the medical terminology. If you're good at, we are obviously good at it. So these two qualities, the combination of this, all the skills, much more needed. You don't need to do different certification or coding certification or everything. When you're joining one organization, they'll teach you, they'll give you certify. Because when I joined here, I don't know, I don't have any certification. So after joined, they trained me well, and they gave me HIPAA certificate, and they gave me like how crucial training about medical coding and all, how to do medical coding. Because we'll be doing, as I mentioned earlier, we'll be doing a lot of multitasking. So for that multitasking only, 6 month vigorous training will be. Because imagine you are going to talk with US healthcare people with that language, with that accent. You should be pro at least intermediate level when it comes to a real time scribing. So that 6 month they'll focus, they'll totally give you attention to how to talk, when to talk, how medical scribe works, how to document, how to conclude your diagnosis, and how to order the things, how to send the referrals. Also how to do the coding thing. So everything they'll train you, and they'll make you a kind of pro fresher. Then your work will start as a fresher medical scribe after minimum 4 months and maximum 6 to 8 months. After that, only your real time production will be started. So that's how it works. You no need to do like a lot of courses that you should start the scribing. As I told you, because people who are from other background, imagine masters in commerce student want to do a medical scribe. So obviously they'll be not knowing about what is medical terminology, how to talk, what are all the medications, conditions, diagnosis and all. They will be needed a separate training. So that's why I mentioned CPMS training is there, a course called especially for medical scribing. For that people, it's definitely they should be certified as a the course completed person, then only they can enter into this medical scribing field. Hope I'm
Yes,
clear.
thank you so much. Thank you so
Yeah,
much, Balamurugan. Thank you.
you're welcome. What should the bachelor student do to start scribing after completion of degree? You don't need to do anything. You just randomly apply. See if some of the scribing companies coming to your colleges, you can attend this campus. Or if not, you just go through LinkedIn. There are lot of scribing institutes, companies across the nation, our nation. You can just simply apply. As I mentioned earlier, you should be good at communication and written, good verbal and written skills, and medical background. Obviously you will be, I know. So with this two strong thing, you can blindly go into this, but you should be compatible with the night shift. As I told you earlier, because night shift, everyone will be thinking, oh, night shift, everything is fine, everything is modern. But in night shift, what we can do, because we are assisting US doctors, so we should rely on that timing. So these are all the qualities you needed when you are stepping into medical scribing field. I think that's for Kavya, and the next one's which is Sanjana. So how and where to join medical scribing course? Yeah, you can go through all the LinkedIn job category. Everybody is hiring. Everyone is hiring. See, if you're looking into my organization, if you go to OG Healthcare in Instagram or LinkedIn, they're also hiring currently experienced medical scribing, medical coders, and fresher medical scribing. So they'll be recruiting every month, every year. All the companies they'll be needing, because demand is more nowadays. All the healthcare doctors from US, they are needing medical scribes to document. So that's why you can apply. Sheikh Naimuddin, in India, how many such organizations are present for medical scribe? Can you name some? And we get paid while we are training. I don't know the reputation of the organization, but I can tell you, as for my knowledge, there are like OG Healthcare, where they can give you a good training. Because I didn't know about other organization training and all. See, here in OG Healthcare, they trained me well. And another one, Scribe EMR, and um, Scribe EMR, I know. Acuity Solutions in Coimbatore, it's one there. Bangalore, it's there. EMR is Hyderabad, and here, and I hope Gurugram somewhere. So these are all some few reputed ones. As for my knowledge, some of my friends are working there. There are a lot of, because this is kind of startup, anyone can so many other startup companies where they'll be doing this, because they need a scribe, that's it. They don't need some kind of large group to do task, because this is one on one. You are a scribe, one patient will be there, your provider will be there, one scribe will be there. It's a kind of triangle. If these three people are there, anyone can work. That's why you can just go through LinkedIn, you just type medical scribe, and then you get to know a lot of organization who are all providing good training and good pay and good work life balance, and then good environment. You can simply start and apply, because I can tell you, starting is matter. Wherever you can start, and then you can switch, and you can go to next levels. So start somewhere where you can learn, and then you switch to your role. Keep growing. Don't, I'm telling you, you don't be a scribe for a long time. You can kickstart your career as a scribe, but you should be, if you ask me, you should be moving to, you should onboard your provider, you should learn, you should gain the experience from that scribing thing. Give the coverages. If some people are taking off in your organization, they want one people to cover them as a scribe, please, your step up. You just cover them, you get the knowledge of another provider. That's how I was not sitting simply at a desk. I was, whoever is needing help, I was just working for them. That's why I finished providers experience till date. So it will be helpful to move to the next phase when you are choosing in the career path. You can be a next one trainer, you can onboard your provider, and the next you can to management level, you can go to operational level. So that's why I can tell you, you should be keep moving. You shouldn't settle at something. You should be keep moving somewhere. At the same time, you pursue your MBA, be strong in management side by side. There are a lot of online MBAs are available. Every day keep learning and upskilling. That's why not only in scribing, not only in IT field, wherever you go, you should upskill yourself, you should update yourself every day. You should learn so many things every day. That's how you can withstand. See, Google, Amazon, everywhere layoffs going on. So we cannot predict. These are all small organization. They can simply tell you like uh, layoff. So that's why I'm telling, learning is important, upskilling is important. You should be upskill yourself each and every day to withstand as compete with a strong candidate people. Do we get paid while we are training? Yes, obviously you will be get paid. You'll be getting stipend when you're I got in my organization initially first month of training, free training, and then next month 15,000 I got, and then next 2 3 months something 25,000 I got. And then when I got doctor approval in a month, I got almost 40,000. That's how it starts. They'll pay you, obviously they'll pay you even in the training period. Anything else? Difference between medical coders and medical scribes. Sorry, I forgot to mention this. See, the cycle will be started from medical scribe. In US, if you take healthcare system, medical scribe will write. Medical coders, they will code. The second step, medical coders. After that, health insurance, you will be knowing like BPO, voice process, health insurance related. This are all the cycle. So it will start from medical scribing. Medical coders will not write a essay, will not write anything. They no need to have typing skills, communication skills. They'll be rich and strong in coding stuff. There'll be as I mentioned earlier, so many codes are there: CPT code, ICD code. They'll code your document, they'll code your entire essay. If you're writing, imagine if you're writing an essay, but they want to code it to make it confidential and to make it secure. So they'll just code all the conditions, all the symptoms, and they'll make it to the separate process. They'll be needing different kind of key and role responsibilities for more knowledge about different types of coding system, more knowledge about how other stuff works apart from this writing skills. We scribes will totally focus on everything, like from writing to ordering labs, sending referrals, ordering imagings, and then concluding a diagnosis. Everything you should be you will be having more and more, everyone will be having more responsibilities when it comes to their forum. I'm telling you, in scribing, as I mentioned earlier, the key responsibilities are more because you'll be doing lot of multitasking. If a medical coder can sit and do at their convenience, like if you wanted to code complete one chart, they can take around 1 hour, like 40 minutes is their convenience. But here you're working in real time. You're working with the doctor who is seeing the patient. You should be finishing at the moment when doctor is finishing the visit. So it's so much attention oriented. You should be giving so much attention. You should finish, you should totally rely on your provider. That's how. This is the difference between medical coding and medical scribing. Sheikh Naimuddin. All right, anything else? Okay, I hope we are done. Okay, if you
Yes, sir.
want, yeah, go ahead. If you want to know anything, if you want to ask me something and regarding medical scribing, how you can start, where you can learn apart from scribing anything, you can directly approach me through my mail, or that's my contact number. Thank you so much, everyone, for your wonderful time. I wish you all the best who have joined this conference, wishing you the best for your future endeavors. And also the organizing team, I'm congratulating again, and best wishes to the entire people who are all working behind this conference. I hope this will be a great successful one for sure. Thank you.
Thank you so much, sir. We are really grateful to have you today, and thank you so much for showing us in and out of medical scribing and giving us a way of how to proceed. Thank you so much, sir. We are once again we thank you for having us today.
Thank you, Jennifer.
And with that being said, guys, we are ending the session, like today's conference by now, and I'm pretty sure that you'll be getting your feedback forms in the comment section. Do fill the form. Your feedback is really valuable for us, and we really appreciate it. So let me give you the glimpse of what is about to happen tomorrow. That is the day 6 of our Sikhon Series 6. We'll be having three speakers: Dr. Hanish, clinical pharmacologist and medication safety officer, KIMS Hospital, will be speaking about from risk to resolution, root cause analysis in clinical pharmacy department. Our second speaker will be Dr. Aaron Joseph, clinical pharmacist and in charge, Department of Telemedicine, Believers Church Medical College Hospital, Kerala, will be speaking on RX remote role of CP in telemedicine. And our last speaker, Dr. Apta Devi, DHA and MOH licensed pharmacist, Dubai, UAE. She'll be speaking on live as an UAE pharmacist, essential insights and migration guidance for Indian pharmacy graduates. So if you're looking into migrating to Gulf countries, or you're looking to talk about telemedicine, a new domain, any such things, please do stick with us till tomorrow. You will be benefited and will be super, super enlightened as like today. So, with that being said, you guys, this is 6th International Conference of RX Doctors, Second 6 Stereo Career Conference Series 6, the ultimate career destination for PharmD aspirants. And I'm your Jennifer and the entire team of RX Doctors signing off. We'll see you guys tomorrow. Good night.